All right, time for our Health Watch with Dr. Syed Hussain from Trinity Health of New England. Good to see you again, Doctor.
Likewise, Tim.
All right, I don't like to do back to school this early, but hey, we're getting there. It's going to be later this month for a lot of schools. Having a healthy start is important, and there's a number of fronts and maybe some bad summer habits we got to try to get out of the way, like sleep schedules. When should we start trying to transition kids back to a more school-oriented schedule?
Yeah, so this month is a good month to start doing that. A few weeks before school actually starts, Tim, would be good. If your child is sleeping at 11 or midnight, getting them back to bed 8:30, 9 p.m. is wise. Try not to do it abruptly over a period of a day or 2 days. That's difficult. Yeah. Maybe you may want to consider doing 15-minute increments of moving the time up so that they can actually get acclimated and used to it and are fresh and ready to go to school when school actually starts.
Especially with the little ones, they won't even notice the 15 minutes. It just goes.
Right.
What about screen time? Maybe kids sort of.
Yeah, this is a big one, right?
Yeah.
We know this. So limiting screen time, especially in the evening hours, is important. There's screens everywhere, phones, computers, laptops, etc. But all of those, trying to decrease the use. And if your children have been playing video games for 8 hours a day, that's also something that you may want to look at differently. Try to do some outdoor activities, get them tired towards the evening, where, and early dinner is also important, and trying to change some of those habits as school approaches.
Yes, those are things I can more easily control. What starts to get my nerves going is when my kids' nerves start getting going about things that they might encounter at school when I'm not there. Is there going to be bullying? Are they going to like their teacher?
Right.
Those are things I cannot reassure my little ones about, especially my youngest, who's going to be 7 soon. How can you help to ease their stress when you can't be there in the moment they're experiencing?
Sure. Now remember, I think it's important for parents to acknowledge that the anxiety is normal. Being nervous the first few days of a new school year is normal.
Yeah.
But things that you can do include, trying to do a walk around the school if possible prior to school starting, or if there's a neighbor or a friend of your child who they can go to school with initial, couple weeks. Even if it's just walking into the school together, that all helps. And then making sure you also touch base with your child's classroom teacher to make sure that if there are any things that they need to discuss with you for the initial few weeks, that you have that line of communication open.
Those orientations always help, especially if they're going to a new school, a new building.
That's right. Yeah, that's right. But acknowledging that they could be anxious, nervous the first couple of weeks is also as important.
Yep, and that is fine. All right, on to other topics here. I always love when there's connections that don't necessarily seem intuitive in medicine, but this is not one I wish we found. There's a recent study that showed that people in their 50s with rheumatoid arthritis were more likely to exhibit cognitive defects compared to people who did not have the disease. What is behind that? Well, first of all, I think people know about arthritis, but what's the difference between arthritis and rheumatoid arthritis?
Yeah, this is an autoimmune disease that impacts joints, but it can also impact organ systems, Tim. And it's one of those inflammatory arthritis conditions that are common, more so in women than in men. But the evidence out there in terms of does it really cause cognitive impairment or brain fog, it's a little bit, the jury's out there because there are a number of different things associated with rheumatoid arthritis that can contribute to brain fog, and that can include medications the patient may be taking, or depression, pain. All of these can actually lead to some sort of memory impairment, cognitive impairment as well. But suffice to say, it's important that if you do develop pain in your joints and other symptoms, that you get checked out, fatigue, fever, etc. You get checked out by your doctor who can examine you, run some tests to see if you have RA. Now, there are a lot of different arthritis conditions. There's osteoarthritis, there's gout, rheumatoid arthritis, there's others as well. So it's not the only one.
So it looks like this is one of those times where there's a correlation, but not necessarily.
That's right.
We don't know for sure that one's causing the other.
Absolutely.
Okay, there we go. All right, Dr. Hussain, thank you so much.
Thank you.
As always, right, helping to sort out fact from fiction and figure out just how certain we are about certain correlations that are out there. It's always very, very important.